Every child, when they first start walking, will look like they are bowling.
Yeah,
Right.
because they're trying to balance.
When do kids come out of that phase and straighten up?
6 to 8 years old.
And if they don't do it by then?
Welcome to another episode of We Need to Talk About This. And today we have Dr. Lim. He is a pediatric orthopedic surgeon. And we're going to be talking about bow-leggedness.
Actually, you know what, Mike? You have a kid.
Yeah.
A very cute one, by the way.
Thank you.
When Casey started walking, were you know how when kids, when they start walking, they're never balanced?
Yeah.
Were you ever worried about, is this normal?
Yeah, Sue-Ann was telling me that, you got to be careful about the way he walks, and you have to be careful about this because it could turn into bow-leggedness. There are certain things that she was looking out for.
Okay, but what is bow-leggedness?
So bow-leggedness basically means that the knees are separated. Okay, so there's a little bow when they walk, like a toddling around.
Yeah.
How can you tell from a kid that, is just trying to figure out balance to bow-leggedness?
Every child, when they first start walking, will look like they are bowling.
Yeah.
Right.
Because they're trying to balance and their knees.
But it's usually not the parents who first notice. It's the grandparents who notice, hey, the child is
Really?
Yeah, or the teachers or the friends will tell them. Yeah, then they will come to me and then we will assess it. But there's actually a physiological norm. When you're born, the physiological bow-leggedness, this is because of the position in the womb. Yeah, so I would say before the age of 2 years old, we don't get too caught up in it because a lot of these cases that look bowed actually will normalize and resolve spontaneously. However, there are some features that sometimes this may not be physiological. If they're not physiological, they will not resolve spontaneously. Okay, so what are the key features? One is asymmetry. Right, so if one side is obviously more affected than the other, that's quite a key sign.
Okay.
The other key that we look at when they walk is this thing what we call a varus thrust. A varus thrust is quite obvious when you step and the child's knee buckles.
Ooh.
Right, so that's another sign for us that, hey, there's something wrong with the mechanics and the way he's walking.
So what would be the average age that you'd pick this up, that you pick these things up?
There's a huge variation. So this was a study done in Finland in the 1970s. So they took like 3,000 babies, followed them up from birth all the way to mature. Varus means bow-leggedness. Valgus means the legs swing the other way, knock knees. So by about 2 years old, you will notice that most children are actually neutral in alignment, after which they will start swinging to the to a knock-knee position, which gets worse by 3 to 4 years old. So if you're still stuck in the varus or bow-legged position at this stage, then there's certainly something is wrong.
So what's the difference between knock knees and bow-leggedness?
Right, so the knock knees is the reverse of the bow-legged
Right.
The knees are knocking.
So instead of the space between the
invert
knees,
it.
now there's no space between the knees. And there's a lot of space between the ankles now.
And this is normal after 2?
Normal after 2. By 3 to 4, they should be the most obvious. Again, this is the next group of patients that get brought to me for reassurance.
When do kids roughly come out of that phase and straighten up?
6 to 8 years old.
And if they don't do it by then?
We look at the axis of the bones.
Okay.
And if this axis is lying out of where it's supposed to be, then that's when we get concerned. We're trying to identify a cause for this.
What are these stages of therapy or surgery for bow and knock?
Exactly.
So both are actually quite different problems, yet similar in a certain way. So for children, of course, we try to avoid surgical procedures as much as possible. A lot of these cases can resolve spontaneously, but it's important to know the diagnosis. Usually we have to assess further with x-rays,
Okay.
and tell whether there is features of pathology. Is this a rickets problem with vitamin D deficiency? Is it weak bones? Or is it a problem with the growth plate of the bone that's causing the legs to grow abnormally? So if it's a vitamin D deficiency, replace it. It's a phosphate deficiency, replace it. But if it's a deficiency of the growth plate is being impeded because of the child's weight or they started walking very early, then we try to offload the leg with bracing. Okay, then we
Walking
support.
early, so we always think, oh, walking so
Yeah,
early,
I
my
was
kid's the
gonna
best.
say, like, oh, my kid's so clever because I start
But
walking at like
it could
9
cause
months.
issues?
Yeah.
So most children will start walking between the age of 12 to 18 months.
Okay.
So when I say start walking a bit too early, is before the age of a year. Yeah, this is the example of the brace.
Oh, okay, this is
something,
it.
Yeah, something like that is very rigid on the inner side of the leg. So you see, it offloads the inner side of the leg when he walks. So the success rate of a brace like that is about 50%.
Okay.
So half the patients go on to improve over time. They avoid surgeries. And half actually needing procedures later on.
Okay, so if you don't resolve it by the age of 12, for example, then is it definite surgery solution?
The problem is because of the mechanics, altered mechanics. This is an example of the mechanical axis that's completely off. You see the green line, which is from the center of the hip to the center of ankle.
Yes.
This line is lying outside of the knee.
Right.
So he's abnormally loading the outer side of his knee. And
Right.
if you let this go on, the knees gets worn out much earlier and much faster than before.
Sure.
So there are some adults that need knee replacements really early on in life, like 40s,
Yeah.
early 40s. If we pick these deformities up earlier, we can actually change the way the bone grows.
Wow.
Growth modulation. These are small surgeries. They are surgeries, but they're very tiny. They're much smaller. The incisions are small. The implants are small. There's actually small metal plates on the inner sides of the knee.
Yes.
Yeah, yeah.
I can see it.
The concept is that we put a tether on the growth plate on one side, so the other side of the bone continues to grow.
Okay.
So over time, the leg will align.
So this took 2 years and 10 months.
Yes.
And that's the normal sort of recovery.
Exactly. So for something like that to work, you need to have at least 2 years of growth left.
So you got to get in there by 12 to be safe.
So most girls grow till about 14. Most boys grow till about 16.
Yeah.
So really we're looking at 12 to 14 age group where you should be assessed for this before that. Because if you miss the
That window.
then the correction will be much more
Difficult,
drastic, difficult.
Yeah.
What if I'm going through this as an adult?
As an adult, if your leg is clearly malaligned, we should try to address it by
Surgery.
surgery. And to correct something like that, you usually have to make an osteotomy, which is a bone cut. So we had to cut through the distal femur bone, open it, and then we fix the position. It's like a fracture.
And that's in your
bone-
leg for life?
You can remove it after a year. the plate.
Well, Doc, do you have any advice for our parents out there who
Parents.
might be, thinking about this?
Yeah.
What they can do with their kid?
So I think before the age of 2 years, if you notice that child is bow-legged, if it's symmetrical and the child developmentally normal, don't need to be too worried.
Okay.
But after the age of 2 years, if you still notice that the child is quite obviously bowed and there's no improvement in the last half a year when you're monitoring them, then you will be prudent to come in to have a check.
Okay. The earlier the better, right?
Yes.
All right.
Okay.
Well, thank you so much for watching another episode of
We Need to Talk About This.
Thank you, Dr. Lam. We appreciate you being here with us.
Thanks, Mike. Let's get
If you enjoyed this clip, don't forget to catch our main series, Let's Talk About Health, on BWatch.